Good afternoon, everybody. I'm Heidi Lowitzer. A little bit about myself. I'm a registered nurse for 30 years, mainly working in critical care, so I work a lot with patients and caregivers who are under duress, in crisis, sometimes end of life. And how I got here, I'm also a widow. So my husband, Howie, was diagnosed in November of 2011 with cholangiocarcinoma. He had intrahepatic, and he passed away in November of 2012, almost to the day, one day short of a year. So a few months later, I found cholangio. It was fairly new, and I offered my volunteer services. And I've been on the nursing advisory board ever since with some of my compadres here. So my discussion will be about coping and mindfulness, and it kind of integrates with Monica's talk about CAM therapy. So coping and mindfulness is just a coping mechanism that will help bring beauty and peace and joy into our lives no matter what the situation. We can always use our coping mechanisms. So mindfulness and holistic medicine, the care of the patient, the body and soul. So it's to be combined with conventional medicine. So we tend to take care of our bodies with conventional medicine and, get all the treatments we need and see our doctors. But we also have to remember that we really need to take care of our psyche and the heart of ourselves, which is where CAM therapies and holistic medicine comes in. Holistic nursing is defined by the American Association of Holistic Nurses as all nursing practice that has healing and the whole person as its goal. It is seen as a complement to traditional nursing, but one that has a very real and calculable result. And holistic nursing protocols include, as Monica said, aromatherapy, healing touch, massage, and guided imagery, which I had to laugh when Gary was talking about his mom using the Pac-Man to go after the cells. My husband and I used to use the White Army. So after chemo, he would lay down and we would visualize the White Army attacking, his white cells attacking the cancer. So that's kind of a little bit of guided imagery also. So we need coping skills to stay calm and relieve our stress and anxiety, especially during treatment of cancer or any huge crisis in our life. So why do we need coping mechanisms, and how do we know when we need coping mechanisms? Some of the events that might happen are a poor diagnosis of a serious illness. We also can have situational crises, which may be your kids having trouble in school, your furnace blew up and you don't have the money to pay for it, a poor diagnosis, like we said. Lots of situational things. Family roles can change, especially with an illness. You have a husband or a wife who are the primary caregiver who now can't give that care, or who are the primary breadwinner and now they can't work anymore. So those are situational crises where we really need coping mechanisms. How do we know? Physically, we can figure from things like bowel irregularities and what are some of the other ones here? Excessive pain that we can't control, inability to focus, headaches, fatigue. These are all physical manifestations that we may need to use our coping mechanisms a little better. But we also have psychiatric ones and ones that touch our heart. So irritability and excessive crying, maybe starting to use drugs or alcohol or increasing the use of drugs and alcohol are signs. Depression, anything like that can be a sign that inside we need coping mechanisms. We need help to get through this crisis. So the definition of mindfulness is the quality or state of being conscious or aware of something. It's a mental state achieved by focusing one's awareness on the present moment while calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations used as a therapeutic technique. So that's the textbook definition. What really is mindfulness? It's both a way of being in the world and a discrete practice. Mindfulness practice can take the form of formal meditation or informal practices, such as simply remembering to be present as one undertakes day-to-day tasks. So a lot of times we drive to work and we're worried and we're stressed, and we get to work and we realize we don't even remember one thing about the trip. We don't remember passing any of our landmarks. We just got to work somehow. Same thing can go with picking your child up from, or missing a concert or a play that they have, or lots of other conversations where people say, don't you remember we talked about this? And you don't remember any of it. So that's things we skip over because we're worried and we're stressed. So this is contrasted to typical experience that may involve ruminating over events of the past, planning or worrying about the future, and analyzing and judging the current experience. So, whoops, we went backwards, sorry. Worrying doesn't take away tomorrow's troubles, it takes away today's peace. This is a very famous saying, and there's another one that says, worrying is like a rocking chair. You may have heard that one. It gives you something to do, but it doesn't get you anywhere. So this is very much what we get carried away with in our day-to-day life. And mindfulness helps us to take a break from, or a lot of little breaks really, from that worry and that stress, and appreciate the good things that are right in front of us, that we miss when we're on that drive and we don't remember anything that happened on the way there. So lots of little good things add up to a good life. And lots of beautiful things, little beautiful things we see every day, add up in the minute and the hour and the day to a beautiful life. Your attitude forms your outlook, and that forms how you view your life, whether it's a good life or a bad life, a stressful life, or has a lot of good in it. So, I might have missed one. No? Okay. So studies show that evidence-based practice, I just put a few of them up here, and you can look these up, or I can give you a list of them, but there are a lot of studies that show that mindfulness and coping skills are very, very important to a lot of different stressors and anxieties. So there are web-based individual mindfulness-based cognitive therapy for related fatigue that showed that cancer-related fatigue was relieved. Stress reduction, pain severity. So people who, this study was about headaches, but there are all kinds of studies about pain and how mindfulness can help reduce pain, and also the stress reduction in 2 chronic illnesses, as you see in that study. Celebrating the big things and the small things. So mindfulness allows you to celebrate every little minute. So this is my husband at his 50th birthday party. And you can see how happy he was. And believe me, every minute he cherished and he appreciated, and he was very mindful of it. This was 5 months before he passed away. So when you focus on all of the little joys in your life, for instance, if you're standing at the kitchen sink doing the dishes and worried about what the chemo treatment's going to be like tomorrow and how you're going to get your husband or wife to the hospital, and your children are in the bathtub and they start singing or they're laughing together, try and stop yourself and appreciate what is happening right there. Listen to that singing. Listen to whatever is going to make you happy. Look at the color of the flowers, the vibrancy of the flowers in your garden when you walk outside the door. For me, it would be my grandchildren's face when I walk in the door, that second that I walk in the door and they see me there. That's something you can focus on for that minute and let go of the rest of it. When you have your pet with you and he's laying in your lap and he's soft and he's trusting you and he's sleeping, that's a moment to cherish and to stop and just be in that moment, as Monica was saying. Clouds, I'm a big sky and cloud person, so that's a big thing for me. Whether they're heavy and dark or they're white and fluffy, always looking at the sky and the sun and the clouds takes you away for that moment into the beauty of what your world is right there. So this is a picture of a sunset, and one of the things my husband and I used to do was go sit by Lake Erie and watch the sunset, and we would sit there for an hour and talk about every level of it as it went down and what was going on around us. And this was mindfulness. We were cherishing those moments, and this was before he was even diagnosed, but afterwards also we would do this pretty frequently. And we would do things like holding hands, going on our little dates, appreciating different things. We came together later in life. We had a lot of challenges in our lives, so I think we naturally were mindful of all the good things in our life. And I'll tell you a little story. We used to hold hands a lot. So one time we were just sitting holding hands watching TV, and I was looking at our hands, and I just picked up my phone and took a picture of our hands as we were holding them. And later on, after my husband was diagnosed, some friends of ours gave us a gift of a trip to Toronto. We live kind of close to the border there, at the Ritz for the weekend. So we went up, and I don't know if they bought the honeymoon package or whatever it was, but when we went into the room, there were rose petals in the shape of a heart on the bed and balloons up at the ceiling. And there at the bedside was a picture. And I was like, what is this? I couldn't really figure it out, and I picked it up and looked at it, and it was the picture of our hands. So that person, the PR person at the Ritz, went on my Facebook to look for a picture of us. They must do this to put at the bedside. And that's the picture they picked, the picture of our hands together. And now I look back and think, wow, that person was mindful, right? They were mindful for me, so I know they were mindful in their own life. They didn't just pick out a picture of us, but they thought that this was a very moving picture to put in there. So those kind of little moments are what we need to cherish to make our lives happier and better. So what is natural mindfulness? We found we were naturally mindful. This is a study that was conducted at Huntsman at the Wellness and Survivorship Center in Salt Lake City here. And they found that some of the things I talked about, looking at the clouds, listening to music, they found that patients with high levels of mindfulness paid more attention to the positive aspects of life, whether they're big or small. It doesn't have to be a big party, but just the little things in life. And all had a profound effect on how they viewed their lives and their illness and the meaning of it all. So, how do you make this happen if it's not in your nature? If you're not a mindful person, in this study, they did a clinical trial at Indiana University, and they enrolled some of their patients in something called MODEL, which is Mindfully Optimizing Delivery End-of-Life Care. And they trained the patients to be mindful, and they told them what to look for, and they sent them out to practice as much as they could. And what happened was these patients found it made a huge effect for them. They found that it worked, and that they were happier, and that their lives were richer and fuller, even if their prognosis wasn't good. So how do you make this happen? Oh, we did that one. So no matter what stage of disease or treatment that patient is encountering, improved coping and the use of mindfulness as a coping mechanism is important in order to ensure their best quality of life and full engagement with their support system and the world around them. And that's really what it does. It brings you into the world around you and takes you away from your worry and stress just for a minute. But if it's 10 minutes a day and 20 minutes a day and 30 minutes a day, then you've gone from all stress and all worry to good minutes and good hours and good days and eventually a good life. So in the end, I may not have ever gotten my husband into a pair of yoga pants. That is true. But watching the sunset wasn't just a romantic moment for me and my guy. It was our form of meditation, even though we didn't realize it in the moment. And it was actually helping us live more fully and more richly while we were here together. And I wouldn't trade that for all the tea in China. Thank you.